May I now request the next speaker, Dr. Himani Narula Khanna, to deliver her talk on the gut microbiome and neurodevelopmental disorders. Over to you, ma'am.
Thank you everyone for staying back to listen to the talk. I know it has been an exhausting day, and I thank the organizers for giving me this opportunity to be here today and present this topic. So let us go on to, at first, when we are talking of the gut-brain axis and its correlation with the neurodevelopmental disorders or its correlation with any mental health disorder, we first need to understand what is a gut-brain axis. So a gut-brain axis is a bidirectional communication network that connects the central nervous system, that is the brain, and the spinal cord with the enteric nervous system, that is the nervous system in the gut. This communication occurs through various pathways. What are those pathways? The neuronal, hormonal, immunological signaling is happening. So this gut-brain axis plays a crucial role in regulating many physiological and psychological processes, including digestion, our mood, and even our cognitive functions. So now, what are the key components how our gut-brain axis operates? So first is the vagus nerve. We have all read this in our anatomy and physiology in the early years, but this is a rapid recall of how our gut-brain axis works. So the vagus nerve is a major neuronal pathway that connects the brain to the gut. It facilitates the transmission signals between the two and allowing the brain to influence gut function and vice versa. What is the gut microbiota? So microbiota is a term, we need to understand the term. That means it is trillions of microorganisms, including bacteria, viruses, fungi residing in the digestive tract, which collectively are known as gut microbiota, and they play a significant role in this axis. So these microorganisms can produce various bioactive compounds, metabolites, which can again influence the brain behavior and function. And the third mechanism is the neurotransmitter and the hormones. We all know there are various chemicals being released, serotonin, dopamine, noradrenaline, so many happy hormones that we've heard of, which are being released, and they both impact the gut as well as the brain. So these molecules are known to affect the mood as well as appetite and other aspects of behavior. The fourth mechanism is the immune system. The immune system, where the gut communicates with the central nervous system through various immune signaling. Here, any inflammation in the gut, any infection in the gut, we see our immune system gets activated and it goes on to fight that microorganism through our immune mechanism, and that is also a lot of inflammatory bowel diseases and those kinds of disorders are linked with depression and anxiety. So there is a definite correlation, and these four mechanisms are the mechanism how it operates. A little bit into the detail we'll go, because unless we understand the gut-brain axis, we will not understand how it correlates with the neurodevelopmental outcomes. So this very intelligent epithelial cell wall separates thousands of microbes from our body's tissue. This one layer will signal what are the friendly microbes and what are the microbes which need to be repelled, the dangerous ones. So enteric nervous system, again we know, is the second brain. The environmental and genetic influences on central nervous system development and function might be affected by these parameters in the enteric nervous system. So of these, serotonin is demonstrated to play a very important role, and it is found both in central nervous system as well as the enteric nervous system. Now the new thing to know, or probably the important factor to know, is that CNS functions, that is central nervous system functions, are modulated by serotonin. We know it affects our mood, it impacts depression, anxiety, cognition, and only approximately 3% of this body's serotonin is located in CNS, while the remaining is in the enteric nervous system, that is in the gut. It is found in the intestine. Very interesting to know that. The vagus nerve and the spinal nerve again are two very important nerves which exchange signals and impact the outcome of how our gut is operating. The spinal nerve control the fight and flight response. It increases the peristalsis in the esophagus, decreases motility in the gut and stimulates the secretion of noradrenaline in postsynaptic ganglions. Whereas the vagus nerve, the afferent spinal and vagal sensory neurons carry feedback from intestinal end to the brain stem, which in turn engages our hypothalamic and limbic system and again is responsible for the regulations of our emotions. So hypothalamic pituitary adrenal axis is again a very important axis, and we have read all this in our physiology, how it operates. The moment we are stressed up, it elicits an emotional response which stimulates, activates this whole axis and leads to an ultimate release of cortisol, which is a key hormone in stress response. The immune system, okay, we know now that we have T cells in the body which fight any microorganisms attacking gut, and it's the immune mechanism of our body. But the gut has a specialized lymphoid tissue in the intestinal wall, in the lamina propria that we have learnt in the physiology, and most of these cells are programmed to be signaled from these epithelial cells and become cytotoxic. The moment they know that there is a harmful microorganism from peaceful situation, they'll turn into a warrior T cell. So they work, these metabolites, they produce various gut microbes, along with those gut microbes produce small chain fatty acid and various metabolites and neuroactive substances like GABA, tryptophan precursors, metabolites like serotonin, catecholamines, and all these induce, cytokines induce an inflammatory response to fight the microorganism or the cells which are dangerous. Now, okay, we have understood that we have a gut-brain axis, there are signals being exchanged, there are mechanisms by which they are interacting with each other. What are the factors which affect this gut-brain axis? So there are maternal, intestinal and skin microbiota, there are maternal vaginal flora, there is the mode of delivery, normal delivery versus cesarean delivery. The research has found that the gut microbiota changes. Gestational age, premature versus term baby, how the babies are being fed, mode of delivery, those who are breastfed versus those who are bottle fed or artificially fed, their microbiota is known to be different. Our lifestyle, how we are eating, what mother is eating, the amount of antibiotics being consumed, and various environmental factors, how much is the fiber in the diet, what is the kind of diet that we are eating, how much is the level of stress when the mother is conceiving or pregnant or after the pregnancy. So all these factors affect our gut-brain axis. Now it's very important, this slide helps us to understand that the brain and the gut microbiota is developing and expanding at approximately the same pace. The moment the newborn is born, there is all the neuronal migration that starts happening, axonal growth and myelination is happening. There is a very rapid synaptogenesis and synaptic refinement happening till the time that the child becomes 3 years. In the same way, the microbiota, there is early colonization happening, gradually successing into a mature and established gut microbiota similar to that of an adult by the age of 3 years. So the first 3 years as the development, the brain development and function is important. Similarly, the gut is also developing and maturing as the microbiota is concerned. So then came a paper which has published this very interesting piece which says that there is a complex exposome genome interplay in neurological development controlling the onset of most common neurodevelopmental disorders in genetically susceptible individuals. The last 3 words are important here. So external exposome is the environment. What is happening in the environment, delivery, the feeding practices, lifestyle and all that. Internal exposome is the gut microbes, epigenetics, and various metabolic oxidative stress leading to inflammation plus a genetic susceptibility. So both these when come into play or come together increase the predisposition and likelihood of the child developing a neurodevelopmental disorder, and maybe later in the years there is a lot of research which says that it does affect the physical and mental health quality of individuals when they grow old. So now the gut microbiome feeling of brain. So what is happening here? The brain has direct effect on the GI tract, or the GI tract can affect the brain. So it's interconnected. This connection goes bidirectional. A troubled intestine can send signals to the brain just as a troubled brain can send signals to the gut. If someone is just made to randomly come here and give a lecture, your bowel will start moving fast, isn't it? Your tummy will start screaming and you suddenly will release all these hormones which will increase the gut motility as a result of anxiety. So there is definitely a correlation. So, and it is common to find, it is very common, they have seen, like in children on autism, they have seen there is 20% increase risk of constipation and other GI disturbances as compared to neurotypical individuals, which clearly indicates that the intestinal and mental disorders coexist in individuals. So yes, they are interrelated. What are the various, what does the research says? The research started with researching on the mice because they couldn't start with working at humans. So they found that probiotics, gut-free studies, gluten, germ-free studies, antibiotic studies, fecal transplant, infections, all those affected the behavior leading to anxiety, depression, pain and cognition. And there are other studies now which have also demonstrated that gut-brain microbiota can significantly affect the stress responsiveness of an individual. Looking at the neurotransmitters, so we know that there are various neurological disorders and they have correlating disturbances in their neurotransmitters. However, the interesting part is there are a lot of neurotransmitters which are regulated, produced by these various microorganisms in our gut. So these microbacteria are required and essential for production of various neurotransmitters. So when these microbiota get disturbed, the neurotransmitters get disturbed, and then these neurotransmitters also are found to be disturbed in our NDDs. That forms a correlation again. So what is happening in autism is there is a dysbiosis, the proteobacteria. Again, the nature of the bacterial flora, the microbiota found in children on autism is different from neurotypical individual as to whatever research we have found in the publication says that. So this dysbiosis lead to increased toxic metabolites, inflammation leading to symptoms of autism. Yes, there are various mechanisms. So what is the answer? Answer is there are various manipulating. We need the newer and most interesting way of treating microbiota manipulation. How can we do it in a safer way? So microbiota manipulation is possible by using probiotics. Psychobiotics are referred to as live bacteria. When ingested in appropriate amount might confer a mental health benefit by affecting the microbiota of the host organism. And this is how they produce short chain fatty acids and various help in production of neurotransmitters. The same 3-4 mechanism that we have heard and studied in the earlier part of presentation are working at improving the outcomes. So we know that we have a lot of standard treatment guidelines which says behavior program, educational programs, medications and other treatment modalities. We can definitely positively consider manipulating the gut microbiota to find an improvement. There are plenty of studies which have been published. Yes, the quality of studies, some are very high quality studies, high grade level of scientific evidence, some are B or C grade evidence of scientific evidence. So there are various studies where they have used different strains and they have found that they ameliorate various behavioral. They have done ATEC scores, they have used various behavior checklists to see the outcomes after giving probiotic supplements for 15 days, 3 months to 6 months of duration, and then evaluating the children again. There are various randomized control trials also done. This is a systematic review which was published, and in autism spectrum, although the results were mixed, some research said that it shows impact and some did not support. In ADHD, the conclusion is there is no study that examined which bacterial texts are correlated with ADHD. So we have lesser evidence in ADHD. This was an Indian evidence. I published a review. My review got published in Journal of Gastroenterology, where we had studied the emerging role of probiotics. Then this is a study and a research which is conducted by me in my developmental center, because I'm also a PhD scholar and undergoing my research. I'll quickly rush through this, where we wanted to study the impact of probiotic supplementation in behavioral symptoms in 2 to 9-year-old children diagnosed with autism spectrum by DSM-5 from Delhi NCR region. So we had some inclusion-exclusion criterias. What we did was, once the child was included and informed consent was sought, the sample was randomized, intervention and placebo groups into 2 intervention and placebo groups. We did a baseline assessment using social responsiveness scale, behavior checklist, GI index and sleep index, and probiotic was given and placebo was given respectively to the intervention and placebo group, and a periodic check was made, and after 3 months of intervention again the end line assessment was conducted using the similar scales. So we found here that after the intervention, the percentage of respondents in the severe social T-score had dropped significantly. So in social responsiveness, in this presentation I have just picked up a part of the outcome. So we use social responsiveness scale, which is a standardized scale to assess the social behaviors, communication and repetitive behaviors, diagnostic, as well as it monitors the severity index, and we found that the social T-scores significantly dropped from 91.7 to 18.2, leading to a considerable proportion of children turning from severe to moderate and mild. So you will find moderate scores increasing. At the same time, there was a drop in the percentage of children with severe social T-scores even in the control group, but the drop was not that significant. Yet the distribution which was seen in both the groups, there was a significant difference, 2.5 times. Similarly, social communication index also showed a significant decline in the T-scores in the experimental group as compared to the control group, and restricted repetitive behavior T-score also showed a significant decline from experimental group area than the control group. So the findings of this trial shed light on the potential role of probiotics in ameliorating social behavior symptoms in children with autism, contributing to the growing body of research exploring novel interventions for individuals with autism. So we need a lot of more studies as of now to be able to say or incorporate it into our treatment guidelines, but we can definitely say that it has or might be having a potential role in helping improve the core symptoms also, apart from the gut symptoms, the core symptoms of children on autism and other neurodevelopmental disorders. So the conclusion here are, we are in the early stage of understanding this complex communication between the gut, bacteria and brain. The gut-brain axis is complex bidirectional network that ensures hemostatic control of GI tract and is impacted by enteric microbiome. We need more evidence on the existence of gut dysbiosis in children with autism and other NDDs. So we need a lot of microbiota profiles before we actually say that the gut microbiota in individuals with NDDs is different from neurotypical individuals. And the effects of probiotics are strain specific, dose dependent. So again, once we study the microbiota, we'll be able to formulate a better psychobiotic to support and improve the outcome. Probiotic strains with proven efficacy and safety must be used instead of those which have no or poor research evidence. Probiotics may fill this current void that we have created or we have in our current intervention method. Long-term clinical trials, however, need to be conducted in children which can show the path for conclusive evidence for its use in future. Thank you. So healthy gut leads to healthy mind, and that is all. Thank you so much. So I finished 8 seconds before the stipulated time.
Thank you, madam, for your excellent talk on gut-brain axis and all the factors. You have talked about the central nervous system, enteric nervous system, and all the gut microbiota and all the hormones and other things which it secretes and neurotransmitters. And you also made a point that serotonin is secreted more in the gut. That affects the mood and other things. Probably everything is related. And I had a doubt regarding that study of yours. Was the diet similar in both the groups? Whether diet
So
can affect?
we have taken a history of the breastfeeding, the feeding history at what time whether how many babies were born by normal delivery. There is a lot of data which we have collected. We are going to see and form more correlations. As of now, we have just presented the outcomes of the social responsiveness scale. We have behavior checklist, we have sleep questionnaire, we have GI index in our research, but a lot more. So I just wanted to get more feedback from people when I present this sectional outcome from my research. And it is yet to be published. I will be sending it for publications and then I'll know what more need to be added.
Thank you, ma'am. Thank you for your
Thank you so
excellent talk.
much.